Welcome, everybody. We're just going to give everyone a couple more minutes, and we'll get started in a minute or two. All right, so I think we're going to get started, everybody. Good afternoon. My name is Ashley Therar with CareAcademy, and on behalf of our host, Home Care Association of America, and our wonderful CEO, Helen Adioson, and the CareAcademy team, I'd like to welcome you to today's webinar. Online Caregiver Training 2.0, how to meet your state's caregiver training requirements with less hassle while saving $1,000 or more every month. Now, here's our agenda for today, just so we're very clear with expectations right up front. In our small amount of time together, my goal is to make a big impact in the following ways. First, create confidence where there was once uncertainty. Second, clarity where there was once confusion. We want to replace all the confusion around the subject of caregiver training with a clear, step-by-step process that has been proven to work. And if we're really lucky, I'm going to help you unlock the potential you have to make a meaningful impact in the lives of the hundreds or thousands of seniors in your community and their family members, while building a growing and thriving business. We're going to try to unleash that potential today. Yet if nothing else, I'm here to show you an easy way to save a lot of money, month after month after month, so you can grow your business faster. How does that sound? Before we get started, I'd like to invite Phil, the Executive Director of HCAOA, to share a couple words with us today.
Thank you, Ashley. Good afternoon, everyone. Again, as Ashley mentioned, I'm Phil Bongiorno. I'm the Executive Director of the Home Care Association of America, and I want to thank you for joining HCAOA and the CareAcademy for this webinar to discuss how home care providers are maximizing training to recruit and retain caregivers. For those who may not be familiar with our organization, the Home Care Association of America, or HCAOA, is the home care industry's leading trade association exclusively representing private duty providers. We currently represent close to 3,000 member companies that employ more than 500,000 caregivers across the United States. HCAOA offers several membership options to serve both home care providers and professionals with an interest in the home care industry. Today, we invite you to join us as the voice of the home care industry by becoming a member. In addition to receiving exclusive member benefits like those offered by CareAcademy, your support will help fund our advocacy efforts both here in Washington and across the country, really to serve your bottom line. We also would welcome you to attend our annual leadership conference, which is coming up in September, and it will be here in Washington, D.C., and we're really excited about this year. Every third year we come back to Washington to advocate on behalf of the home care industry, and this year's theme is the voice of home care for American families, advocating for our seniors. And this will focus on the importance of being an advocate on behalf of your clients, the senior community, as well as their families. Attendees this year will receive education and instruction on how to improve their advocacy skills at both the state and federal level, and put those tactics at the annual leadership conference, Congressional Lobby Day, excuse me. And exhibit and sponsorship registration is currently open, and we will have attendee registration opening early next week. So for more information about HCAOA membership or our annual leadership conference, please visit hcaoa.org or contact us at info@hcaoa.org. And to conclude, I just want to say that caregiver recruiting and retention, it's the #1 challenge. We survey our members every year, and this becomes the #1 challenge to our industry. And the work that CareAcademy is doing to help combat these challenges is imperative, and that's why today's topic is so important. Again, we appreciate the opportunity to collaborate with CareAcademy today on the webinar to help you provide solutions to your caregiving training needs. And with that, I'll turn it back over to Ashley. Thank you.
Yeah, thank you so much, Phil. CareAcademy will definitely be at the conference. We're really excited for it. But whether providing training on the latest business strategies or technologies, or hosting a dynamic annual leadership conference on today's cutting-edge issues, HCAOA really enables home care companies to grow, advance their worker skills, and meet the needs of America's seniors. And we're going to do that today. But what I'm going to need from you today is an implementation mindset. Nothing pains me more than giving you a solution that will make a positive impact in your business and in your personal life, then running into you several years later, most likely at the HCAOA conference, and you're still stuck in the same situation, clinging to the old way of doing things. I'm going to need you to think in terms of the results that you want to achieve and the actions that you will take to get those results. We're not here to just collect information or share knowledge. Here's a quote by a famous entrepreneur and thought leader that I follow. Information is good, but you know what's incredibly more valuable? Anyone? Experience. Think about that for a second. When you take action on what you've learned, you start the process of turning information into valuable experience. Let me ask you a question. Have you ever learned about something really cool? Something that could positively impact your business or your personal life? But at the time you were very busy and you never got around to taking any action. Sure, it's happened to everyone, myself included. That's why I need an implementation mindset today. I hope that you watch this and say, you know what, I could start doing this over here. And I bet that technique that Ashley's talking about would make my life or my administrators or recruiters' life a lot easier. Sound good? Okay, let's get started. So what is CareAcademy and exactly what do we do? CareAcademy is an online education platform that teaches caregivers to provide safe and confident care to older adults. The company was started just a couple years ago in 2015 by Helen Adioson, who's our CEO, and she's been working as a caregiver throughout college and graduate school. She often found that when she would go into a client's home, she was unprepared to provide the best care to meet their needs. When she spoke to her peers, other caregivers, she realized she wasn't alone. while she was at the Harvard Graduate School of Education, she realized that this was a problem she passionately wanted to solve. She met her co-founder, Dr. Madhuri Reddy, a geriatrician and assistant professor at Harvard Medical School. Together, they combined the best practices in education and home care to provide engaging training programs that are relevant to your caregivers and will prepare them to better serve your clients. In just under 3 years, we have over 20,000 caregivers enrolled onto our platform. Believe it or not, an NPS score of 100 and completion rates of 92%. We work with many leaders in this space that include Home Instead, Comfort Keepers, CareLinks, and Honor, just to name a few. These agencies and platforms are seeing real results that are helping with their biggest business challenges. I love to walk through some of these real results, but I'm sure you all are doing some sort of caregiver training already. Let's do a poll. Please pull in on what you currently use for training. So A for IPSID, Relias, B for Relias, C for other online provider, or if you hire a trainer, and E if you use a current staff, like an HR person. Okay. Give you a couple more seconds. Results are coming in now. I think about 70% of you all have voted. So if you want to vote, just give a couple more seconds here. Okay, so it looks like 58% of you use a current staff member, an HR person, and 23% of you use IPCED, and 3% Relias, 8% other online provider, and 7% hire a trainer. Okay, this is great. It's good to know going in. I can definitely, while we're walking through just CareAcademy training, show you all how we differ and how our agencies have the results that they've gotten switching to CareAcademy. So at CareAcademy, we like to think of ourselves as Caregiver Training 2.0. So Caregiver Training 1.0 means just the hard skills, how to do this or that safely, meet your state's requirements. But Caregiver Training 2.0 is when you can also teach soft skills, the skills that really matter and make a difference. Like how to communicate effectively and professionally with clients and their family members, how to manage challenging client behaviors, and how to make empathic and compassionate approach to caregiving. We believe these soft skills take a lot of the stress out of caregiving, which leads to caregivers staying longer and often results in your caregivers becoming referral sources for both new clients, new caregivers. I'm sure some of you have experienced this already with some of your best caregivers. Agencies just like yours are utilizing CareAcademy to recruit the very best caregivers that meet the needs of their agencies as well as clients. They also onboard those caregivers faster. They keep their caregivers post 90 days at a higher rate and provide caregivers ongoing education for learn-to-earn programs, upskilling, and caregiver engagement and retention. I would like for you all to think about your current training programs. So most of you all said that, that you have staff members doing the training. A couple of you all are already doing some online training. How can you maximize your training program to bring upon efficiencies in your agency, decrease cost, and improve caregiver engagement? It's definitely possible. We have agencies that are doing that, and I really want to show you all the results that they are seeing. So you may have already heard of agencies utilizing training as a recruiting filter so applicants understand the job before they get hired. But what happens when caregivers are unable to access the class and complete it? CareAcademy training has a 92% completion rate. Believe it or not, a 300 caregiver Massachusetts agency, Best of Care, actually saw a 482% increase in completions by switching from an in-person trainer to online training with CareAcademy. Not making it up. 482%, guys. And Massachusetts doesn't even require compliance rating, which is incredible. So we have agencies every day that are attracting the right caregivers and making sure that they're finding the best fit for their agencies. Platforms like CareLinks are attracting caregivers by providing upskilling opportunities. As CareLinks caregivers take and pass various classes, they earn badges. They appear on their CareLinks profile, such as silver, gold, platinum, and diamond. The courses are available at no charge to the caregivers. This helps CareLinks not only attract quality caregivers, but also attract referral partners. These healthcare systems have high expectations for education-related requirements that caregivers must meet in order to deliver highest quality care to clients. Another challenge that our agencies face is once they've hired a caregiver, quickly getting the caregiver up to speed on policies and procedures and basic caregiver training to get them working faster. I hear this all the time from our agencies, and I'm sure there are a lot of you here that experience the same challenge. One of our agencies, a California-based Comfort Keeper agency, saw a reduction of onboarding time from 5 to 2 hours with only 2 months of utilizing CareAcademy training. That is a 60% reduction in time onboarding new hires. It saves time for the caregivers, administrators, and gets the caregiver working faster. But you know what's the most interesting thing about this statistic? This agency was utilizing an online caregiver training platform already prior to CareAcademy. I hear this all the time from agencies. They might be utilizing one of the other online training programs out there, and because of technical issues and no mobile compatibility, agencies have to actually buy computers so that their caregivers could come into the office and complete their training. They received so many complaints from their caregivers that had issues logging in, not being able to view the training on their cell phones, that they actually had to go out and buy computers so that their caregivers could complete this training on time. I'm sure all of you know the statistic from the 2018 Home Care Pulse report that states that 81% of turnover happens within the first 90 days. I don't know about you guys, but I was shocked when I heard this. Within the first 90 days. When we spoke to our agencies, we realized that one of the reasons why the drop-off was so high was that caregivers accepting the job didn't understand what the job was. They didn't understand the personal care and the soft skills needed for the job. So they joined, they went to the onboarding process, and in the onboarding process, they were like, whoa, I have to do that? So they quit. Our agencies are requiring a training program pre-orientation to determine which caregiver is most likely to complete the training, but also to understand what is required to be a successful professional caregiver. This is not only a great way to identify which caregivers will be the most successful at your agency and for your clients, but also to reduce the number of hours needed to onboard your caregivers. I'm not sure if you heard Andrea from Houseworks talk at the HCAOA National Conference in Austin last November, but she highlighted how utilizing a CareAcademy training, her agency saw a reduction in caregiver turnover in 1 year from 38% to 10%. That's a 74% reduction in caregiver turnover. CareAcademy can save a lot of time and money when it comes to meeting your state's caregiver training requirements. And we're doing that for agencies just like yours across the country. But that's just step number one. We're also helping owners attract and recruit the best caregivers in their area and onboard them faster. We're also helping owners build retention and recognition programs centered around education and learning new skills. In the very near future, we're really excited about this, We'll be creating a way for our customers to use our training and certification programs as a marketing advantage. So you can set your agency above the competition and win the trust of high-value referral partners at your local hospital, your local nursing home, anywhere that you get referrals from. Do you think that going above and beyond caregiver training is going to help you in referrals? I think it will. And I think just seeing our agencies that are able to use our training to get referrals would agree as well. So before I go into showing our content and product, I'd like to hear from you. What is your biggest pain point with your current training process today? So pull in, A, if it's mobile compliance, B, for technical issues for admins and caregivers, C, reminding caregivers of their training, D, if caregivers not liking their current training, or E, if caregivers not showing up to the training is the biggest problem, or just all of the above. And this poll is actually a bit different than the other one. You are able to select multiple options. Polls are coming in. Give you a couple more seconds. We have about 68% of the folks that have voted. Okay, so it looks like 61% caregivers not showing up to the training is the biggest problem. 50% of you all say that reminding caregivers of their training is the biggest issue. 27% say mobile compliance. 24% say technical issues for admins and caregivers. And 19% of you all say caregivers not liking their current training. This is great. I get this feedback from agencies all the time, so I'm glad we're all on the same page before I should go in and show you all our content and our product. Thank you for calling in. So this is what our Caregiver Dashboard looks like from a caregiver's perspective. I'll show a little bit later how the Administrator Dashboard looks like, but it's very easy to use. Your caregivers are able to see the classes that are assigned to them, the certificates of completion of the classes that they've already completed successfully, and can use this chat feature down here that exists on the dashboard, and I'll show you in the admin dashboard, it exists there as well, in each individual class. So if your caregivers are having any issues with the chat functionality or with any issues with their training or logging in, they can reach out to our customer success team and they'll be there to help them. So let's go into a class. We actually shortened our video from our assisting with bathing class just so we can go over it a little bit here today. So I'm going to play that for you all.
As a caregiver, you likely need, at some point, to help a client with a bath or shower. This can be an intimate bonding activity, but it has its challenges. A little bit of preparation and clear communication can make all the difference in making bathing less complicated. First, find out how often the client wants to bathe.
Well, we only need to take a full shower or bath 2 or 3 times a week. Otherwise, we can do washcloth baths. What's your preference?
Well, twice should be enough. Maybe Mondays and Thursdays?
You don't have any standing appointments on those days?
Not now, no.
Choose days that are not consecutive, and schedule full soak baths for days without other appointments or activities, so there's no need to rush and no need to worry about interruptions.
Perfect. We'll do spot cleaning on Wednesdays and Saturdays. How does that sound?
Check the client's care plan to see what special needs, including equipment, they may require while bathing. If you are unsure of anything, talk with your supervisor and the client's family member if they are the main decision maker for the client. When it's time for a full soak, gather all the supplies you'll need, like soap, washcloths, and towels. You'll need multiple washcloths, one for the face, one for the older adult to use if they're helping, and at least one for the groin area. It's also good to have multiple hand and body towels for drying and for privacy and warmth. Help your client to the bathroom and encourage them to use the toilet prior to their bath. But don't be surprised if the urge to urinate or move bowels occurs while bathing. Warm water can encourage the need to go. Delicate skin is also extra sensitive to temperature, so be sure to check the water before having them enter. Providing towels to cover up shows respect and provides dignity for your client, alleviating concerns about modesty. Usually, it's okay to just use water on the face. Have them close their eyes and wash the face first, then gently dry. Now you can move on to washing the hair. Your client may want to keep a cloth over their face while you do this. Once you've washed and rinsed their hair, put soap into a washcloth and wash their chest, arms, legs, and feet. Use gentle circular motions and be careful not to rub too hard.
There you go, good job.
Older adults may become very cold while bathing. Once you've washed and rinsed an area, place a towel over to help keep the chill away while you move on. Use another washcloth to wash their back.
All right. Now, can you stand okay from there?
If they're already standing, you can assist washing the groin area, front then back. If they're seated but able to stand safely, have them stand so you can wash the groin area, front then back. If they can't stand, just do your best to access the groin and bottom while they're seated, and rinse everything well.
Hope you all enjoyed that video. It's actually one of my favorite classes. I want to go into one of our classes now and show you how how the actual class looks like. So this is our Assisting with Bathing class. I just showed you one of our videos. But what I also want to show is the interactive activities that we have throughout our classes. So all our classes look like this. They're 80% video-based, but we also have interactive activities throughout our classes just to make sure that the caregiver is retaining the information that is being taught in a particular class. So we have checklists such as this one. We get a lot of feedback from our caregivers. Each class actually has a feedback loop where caregivers will give their ideas on what they thought about the class. But what we find is that the caregivers, especially beginner level caregivers, will print out a checklist like this or pull it up on their cell phone device before they go into a client's home, just so they're prepared and can review what they need to do once they get to a client's home. We also have, I'm going to skip a little bit here, go to some other interactive activities. So we have flip card activities like this. Again, just to make sure that the caregiver is retaining the content that is being taught. Interactive activities such as this one as well, just so you all get an idea of what our classes look like. So all our classes are created by geriatric specialists, which includes geriatricians, nurses, dietitians, and physical therapists. I will go back to my slides here so we can do this again. Like I said, our training is all 80% video-based. It's enhanced with interactive exercises, like the ones that I just showed you all. But what makes us a little different than the training that you might see out there today is that we don't have any static slides. So there's no PowerPoints, no slides. It's all engaging videos that our production team works very hard to make interactive and make sure it's fun for the caregivers who take the training. We have a final test at the end of each of our classes. So caregivers are required to score an 80% on the test in order to pass the class and receive a certificate of completion. Our test questions are pulled from a test bank. So two caregivers can be taking the same test. They may see different questions or questions in different order. Our content and production team receives the regular feedback from our agencies and caregivers and ensures that classes are reviewed by subject matter experts before we release them. This means that your caregivers will always receive training that is relevant to their professional development and needed for them to provide good care. And we provide new classes on a quarterly basis. So we have new classes that we'll be releasing before the end of the month that include Parkinson's disease, dementia, obesity and weight management, an overview of diabetes mellitus care. I said that properly. In July, we keep an eye out for new classes, We have an overview of care after hospital discharge releasing, improving caregiver empathy, and we also have overview of care after a stroke. I get this question a lot. We're actually able to currently service 43 states, and we'll be able to service 46 by the end of the year, and all 50 by the end of next year, pending state approvals and any new state regulations. All of our classes are mobile compliant, so I know about 27% of you say that mobile compliance is an issue that you're currently having with training. Actually, majority of our caregivers complete their training on a mobile device. So we make sure that our classes are being able to work and are able to be viewed and taken on a mobile device. That's something that we take a lot of pride in and spend a lot of time to make sure that caregivers are able to properly access their courses on a mobile device. And the Owners Academy and business training. So all our content currently is focused towards a caregiver's learning and professional development. But we do have webinars throughout the year that are focused more on owners and what they need to help grow their businesses. So we just had one with Bob King. I'm sure a lot of you are familiar with Bob. In January, that was how to prevent sexual harassment, which also happens to be a requirement in California for administrators. And then we have another webinar coming out that we're really excited about that will be how to get your website #1 on Google within 24 hours. So we also try to incorporate the best practices in the industry and use a lot of thought leaders to have webinars throughout the year to support our agency owners. I'm going to shift here to show our dashboard. So this is how our dashboard looks like. In one view, you're able to see all your caregivers and assess the progress of all your caregivers in terms of initial training, annual training, their due dates. So you're able to toggle. You can say, I want to see what the progress is of everyone's initial training. So you can see it this way. You can see everyone who's completed initial training and who hasn't. And the progress of everyone's annual training in your agency and the due dates. So I'm going to go into one here. So go into Lillian. So again, so it shows here that she's completed her initial training. It looks like she hasn't started her annual training. So when you drill down into a caregiver, you're able to see all the classes that are assigned to them. So it looks like Lily in 2017, these are the initial training requirements that she completed. This is the annual training that she completed. And then you're also able to see additional courses throughout the year. So a lot of our agencies do this. They'll assign courses throughout the year in terms of for coaching needs. So it looks like she's been assigned a couple of courses with deadlines as well here. So a lot of our agencies, like I said, like to assign courses throughout the year. So I would love to show you all how to do that. So for example, you can say that, you know, Yvonne might be a beginner level caregiver. He might be going next week to help a client of yours that has cancer, and Yvonne's never worked with a client with cancer. So you can say, okay, I want Yvonne, before he goes and goes and meets with a client, I want them to complete some classes around cancer. So you would go here. You would assign overview of cancer care. You would assign a due date. So you can give him till the 18th. Save. And Yvonne will be assigned that class right away. What you can also do on our dashboard is message Yvonne. So he'll receive a text message right away. So you can say, hi Yvonne, please complete review of cancer care by the 18th. You go see the client. And Yvonne will receive that text message right away. You can also assign, so a lot of our agencies also do learn to earn programs. So you can select all your caregivers and assign a particular class, or you can say, for this month, we're gonna do a contest, and everyone that completes the 6 or 7 dementia-related classes on the CareAcademy platform, you'll be put into a raffle for a TV. So you're able to use the same functionality and add classes to all your caregivers at once. You're also able to message all your caregivers. So you can send a text message to all your caregivers. You can say, we're having a caregiver banquet, or we're doing an in-person training, and all your caregivers will receive the text message right away. Another feature that I'd like to show is the Waves feature. So for example, Yvonne here looks like he has 2 classes, initial training, that he hasn't completed yet. You know, this is pretty common in the industry where a caregiver could be working for multiple different agencies. And so you might have a caregiver that's worked for you in the past, or a caregiver that has already done training at a different agency. And if they provide you all the information that they've completed the training, and you are okay with the skills that they've learned in that training, you're able to waive requirements for that caregiver. So you can just click here, say, you know, what the class was, the description of the class, who trained the caregiver, who the trainer was, the location, and the completion date. This is really great, especially for our agencies that are in high compliance states, because the compliance reports, which I'll show you in a little bit, will capture all the training that your caregivers will take in one report. So when, you know, an auditor comes...
Already have captive caregivers as part of their registry.
Sorry, can you mute? I'm not sure who that is. Please go ahead and use the chat functionality if you have any questions or comments. Right? So the reports that I was talking about, so you're able to print out, for compliance purposes, all the training that your caregivers have completed in one view. So the date they completed the training, the title, the description, the number of hours, and that's why that waive feature is so important. So if a caregiver has completed a training elsewhere or at your agency, you're able to capture that and also save money. So if the caregiver's done the training, you're able to capture it and not pay that caregiver the extra hour to complete a training. What you're also able to do is, so a lot of our agencies like to print a physical copy of certificates. So you're able to print all the certificates at one time. So you'll have all these certificates of completion all in one view. A huge differentiator that I haven't talked about yet is our customer success team will, based on the deadlines, so your internal deadlines or the deadlines by the state that are captured here in the dashboard, our customer success team will coach your caregivers to complete the training that is assigned to them. So they'll call, email, and text your caregivers to make sure that they're progressing and completing training in a manner that is needed and progressing through it in a timely manner. And you're able to see in the message log up here all the messages that have been sent from our team and your team to your caregivers. So Yvonne here can say, you know what, I never knew that I had to do training. I never received any notification. So you can just go up here, search Yvonne, and see all the messages, text messages, emails that Yvonne has received to complete the training. So when we onboard, if you do all sign up with us, and if you, during our onboarding, so our customer success team will spend 30 minutes with your agency admins or owners and whoever's involved in the training process and help not only onboard all your caregivers, but also help you select the curriculum that might be needed for your state requirements or internally help you select your curriculum and onboard all of your caregivers at once. But on an ongoing basis, a lot of our agencies will, want training added to a caregiver right away when they're hired. So on an ongoing basis, you can easily just go here, click on New Caregiver, add your caregiver's information, and they get access to the training right away. And what's also great is that the administrators, just like the caregivers, have access to our customer support team live. So you can easily message our customer success team. So one of the main questions we get is, I just added a new caregiver, and the caregiver isn't very tech savvy. Can you help? Can you please help us? Make sure that she has access to her training and is getting started right away. So you're easily able to use our chat function here. And you should get a response right away on any issues that you might be having. Looks like Bianca's typing there. Okay. But I'm going to move on. We're going to go back to our slides here. So talk a little bit about our customer success team, but they are available for 24-hour customer support. You can reach out to them via phone, via chat, or email, and they're typically our response rates are very short, and we'll get back to you on any issues that your caregivers might have or that you might have regarding your caregivers. hear from you all on what you think, about CareAcademy's content and our platform and our solution. Do you think your caregivers will like this type of training compared to what you all are doing now? Do you feel like this is something that will make it easier to recruit and onboard your new hires? Do you think your referral sources will appreciate your commitment to superior training and be more likely to put you on the top of their list? Just talking to our agencies, I think they will. So yeah, feel free to chat. I'd just love to hear which of these 5 things that you think would help the most. How many hours do you think that this could save you? Just the dashboard alone. So we actually had an agency out in Virginia that saved so they had about 60 caregivers. They saved 13 hours every month their administrators were saving just utilizing our dashboard. So I'd love to hear, how much time that would save. A lot of you said that some of the issues so 50% of you all said that reminding caregivers of their training was a huge issue. So having our customer success team reach out to your caregivers on your behalf, how much do you think that will save you all? Okay, so while the responses are coming in, what I'll do is I'll move on to just show our promotional pricing. So we have some promotional pricing for you all today. Thank you so much for joining the webinar, and I can go through that. But before I do have 2 little disclaimers. CareAcademy is not free, but it will save you more money than it costs. And the CareAcademy is not the cheapest solution out there, but it is the best. So who is this for? It's generally for 2 types of people. CareAcademy is for home care agencies who are looking to grow aggressively and become the #1 provider in their area. CareAcademy is also for business owners who appreciate the value of a turnkey, repeatable system that are not dependent on any one person. So for all of you all that are here with me today, thank you again for being part of the webinar. We were offering some promotional pricing. So normally we charge a $499 setup fee, which covers our costs to get you started. So remember with CareAcademy, we're able to get you help with most out of your training. So we're able to help you all select your training classes to get you all onboarded faster, but more importantly, to save you time. We know you're busy, so we want to make sure that you get the assistance you need when you need it. So there's no phone tag, there's no long hold times, no email-only support. When you need help, you can pick up the phone and we will take care of you. But here's what we're going to do today. I want to get all your questions answered. So if you have any questions, start typing them up in the chat box. And we'll get them answered today as much as we can, as much as time allows. But while we're doing the Q&A, I have a special offer for all of you. Anyone who signs up right now will get free setup. So you'll be able to save $500 if you get started with us today, and the $99 if you have up to 10 caregivers, up to 25 caregivers, it'll be $199 per month. Up to 50, it'll be $299 per month, and then $499 per any additional caregiver. But the $500 savings would only be if you sign up during the webinar, and then it will go away at the end of the webinar. And just so you all know, we do have a 30-day guarantee in our contract. So if you, if for whatever reason, if we were not able to help you, or if there are any issues with during the 30 days, you're able to get out of the contract within 30 days. So I'm going to have this link up here. If you want to, this is not a contract. You'll be signing up and we'll send you a contract right after the webinar. But make sure you are taking advantage of the $500 savings. We don't do this often. And in the meantime, I will take any questions. I'm sure you all have a lot of questions. So feel free to put them in the chat box. Okay, so the first question here, how many classes are included in CareAcademy? So we currently have 32 hour-long classes right now. We will have 40 by the end of the month and 60 by the end of the year. But we have videos that can be used. So we have hundreds of videos that can be used outside of our hour-long classes, and a lot of our agencies utilize those as well. Okay, so another question. If I sign up now, will I get the new courses when they are launched? Yes, absolutely. So when you sign up with us, you have access to our whole course library. So you have access to all of our current courses and all the courses that we release on a quarterly basis. And your customer success team, or our customer success team, will make sure you're notified when new classes are releasing, and will help you also assign them to your caregivers if needed. Okay. How does this work when I have 2 or 3 offices? So that's actually a really great question. We work with a lot of agencies with multiple offices, and so we can set it up depending on what works best for you. So if you have one administrator that is in charge of training for all 2 or 3 offices, we'll set up one dashboard for you and help you assign the classes, and you'll be able to log in and see all your caregivers in one view. If you have multiple administrators, or if you want multiple dashboards, whatever works best for you, we can do that as well. And our agencies work both ways. But you'll have visibility into all your offices and the training assigned to each of the caregivers. Do you have classes on dementia? So yes, like I said before, we do. So we have introduction to dementia care, communicating with a person with dementia. We have end-of-life dementia care. So a lot of dementia classes, yes. Keep them coming. Loving these questions. They're great questions, guys. What does the rollout of this program look like? So like I said, when you sign up with CareAcademy, our customer service team will have a 30-minute call to get your administrators, as well as the owner, whoever's in charge of the training process, introduced to the CareAcademy platform and how to best use it for your agency. So we will help you select classes. So we have a compliance team in-house that has recommended courses for all of the states. And so if you just want to use a recommended course list, we can certainly do that. But if some of our agencies like a more tailored class curriculum, and we can definitely help with that as well. So they'll help you select your classes. They'll help onboard all of your caregivers onto the dashboard, make sure everyone's assigned with the due dates. We'll also understand from you what the due dates you want to be. So some of our agencies like the end of calendar year, some base it off of hire date, again, depending on where you all are at, just so our customer service team knows when to reach out to your caregivers to help them progress through their training. And something I didn't mention actually earlier was we also proactively reach out to you if we're unable to reach out to your caregiver. So our customer service team will let you know, if we're having issues with reaching out to a caregiver, just to make sure that no one's out of compliance and everyone's on track. Other questions? How well do the courses run on a smartphone? Our courses are specifically designed to work on smartphones, so they work very well. And if you reach out to us, we'll be more than happy to give you a class. And I always suggest that you take the class on a mobile device, on an iPad, on a desktop computer, just so you get the caregiver experience. But majority of our caregivers do take the training on a cell phone device. I even had somebody, an administrator, that just wanted to test out the class and drove around with the class just to see if it would still work. She wanted to see if the videos would still be seamless, and they were. If a caregiver leaves, this is a really great question. So if a caregiver leaves the training and comes back to it, do they need to start over? No, they do not need to start over. So caregivers, if you left in the middle, 2 minutes into a video, when you came back, that caregiver comes back to that class, they'll be taken back to the 2-minute mark of where they left off in the video or in the class. So they don't need to go fishing for where they left off in their training. Okay, so I'm also getting a lot of questions in, will this work in my state? So like I said, we have approval in 43 states. We'll have approval by the end of the year in 46 states. So the states that we currently yet need approval in and are waiting on is a District of Columbia, Georgia, which we should have by the end of the year, Florida, which we should have, I believe, in a couple of months here in Q3, Rhode Island, and New York. So some of these states, such as Rhode Island and New York, were able to provide annual requirement training. So we're still waiting on approvals here in terms of compliance training, but we actually do have agencies in these locations that use us for user classes that they want in addition to compliance training for their caregivers. So a lot of our agencies especially find value in the soft skills that we make sure to incorporate in all of our classes, so especially in dementia care, heart disease, cancer care, those type of classes. The soft skill component that is pretty unique to us in all our classes. Our agencies are still using, and so if that's still if you still want to wait for the compliance piece, please do reach out to us, and we have a list going, and we'll definitely make sure to notify you as soon as we get approvals in those states. So does the training have scenarios that teach caregivers how to interact with clients? Yes, and so I really hope that you were able to see that with our assisting with bathing video, but that's something that is very, very important to us. We make sure that our classes have video scenarios of caregiver and client interactions, and we even have in some of our classes the incorrect way to go about doing things, and then the correct way. So the caregivers can truly see the difference there and get trained on the best scenarios, so they're ready when they go into a client's home. What I actually thing I can do is, as the questions are coming in, is also show our class list. Let's see, let me pull that up. So this is our class list, and you can definitely make sure that the folks that are interested and can get this after the webinar do reach out to me. But we have classes, and they're all the way from a beginner level caregiver all the way to a bit more advanced training. So we have what does it mean to be a professional caregiver, clients' rights, communicating with older adults, assisting with activities of daily living, all the way to managing specific health conditions such as heart disease, Parkinson's, HIV/AIDS, nutrition. And then what we, so again, I'll make sure that everyone has access to this list, but we also release to all our agencies the classes that we have planned. So there's a couple that I listed out earlier today when I was going through the content section there, but we also release which classes we have in development, and we love the feedback of our agencies and our customers on which training they think that their caregivers need, and try to prioritize that based on the feedback that we're getting as well every quarter. So we have sexual harassment prevention, assisting with oral hygiene, overview of end-of-life care, heartburn, constipation, diarrhea. Some of these classes are planned in the works for 2018 and will be released in 2018. Okay, we're looking through some of these questions. Let's see. Okay, so this is a good question, actually. So what happens if a caregiver does not get 80% or better on a test? If a caregiver does not get 80%, they do not receive a certificate of completion from CareAcademy, but they do get multiple chances to be able to get that 80%, and they can also go through the class as many times to review to retake that test. Okay, how can I determine which states are serviced by our current slate of classes? We are a startup that needs to invest in training. Yeah, so if you're in multiple states, I'll make sure everyone has my contact information, but also do call us, and we'll make sure that we can help you through that and discuss which states that we're able to service. But again, it's District of Columbia, Georgia, Florida, Rhode Island, and New York that we're currently still waiting on approvals for. But all the other states we can service. Can you tell us more about the reminders? Are there automatic reminders built in? Can we customize them? So so the reminders, again, that's a huge, saves a lot of time for our administrators. just 13 hours, like I said, for one of our agencies, it saved per month. So our customer success team will, again, based on the deadlines and the due dates that you have for your caregivers, will call, email, and text your caregivers to remind them and help them progress through training. There are some automatic reminders built in via text. We found that caregivers respond better to text messages than they do to emails. So we do have some automatic reminders there. And whether you can customize them, you know, I know we've gotten that feedback before. Our product team works very efficiently and very quickly. I would love to get back to you on if that's something that we have on the roadmap to build, but that is some feedback that we've gotten in the past. And I'm sorry, I would have to get back to you on if that's something that we are doing. Oh, in terms of let me correct myself. Sorry. In terms of automated reminders, but you know the functionality to message your caregivers in real time is available. Like I showed in the dashboard, and I can definitely pull it up again. But you're definitely able to, in real time, reach your caregivers through the platform and send them text messages. Whether you can customize this, automatic reminders, I would have to get back to you all on. Apologize there. You mentioned the courses are designed to work on smartphones. Do they also work on laptops and tablets? They absolutely do. I wish I had the percentage up with me on the number or the percentage of caregivers that take our training on a tablet, on a laptop, but again, majority of them do it on a smartphone. But reach out to us. We'll be more than happy to give you a class to try out, and please feel free to again test it out on a smartphone, on a tablet, on a laptop. We get some great feedback that it's easy to use. The videos are seamless. And we work with a lot of you all might know this already, obviously, but we work with a lot of caregivers that may not be very tech savvy, and then we've tried to make the training accessible and easy to use for a caregiver of any level and tech savviness. Do you report course completions to CE broker? I'm not sure, actually. I would love to get back to you on that as well. I don't believe we do that currently, no. Are there any plans for integration with some of the home care software providers like ClearCare, AccessCare, and MatrixCare? There aren't currently plans for this type of integration. It's certainly we were certainly having conversations with some of these providers on how we can provide additional value to our agencies. A lot of our agencies, we've gotten some feedback that this would be helpful for them. And so we'll definitely keep everyone updated on that. If you're not signed up already, please do sign up for our newsletter. And we do have the latest product developments as well as content developments to our customers as well as non-customers there as well, and so we'll definitely keep you all updated. It is something that we are currently looking into, yes. So I'm sorry, guys. So we've actually gotten a lot of questions. So if I haven't answered your question, if you could please type it up again. The window here is quite small, and I'm trying to scroll through all the questions. So please do answer it or ask it again if I haven't been able to properly answer any of your questions. And do really appreciate the questions and the collaboration here that I'm getting. How can we schedule a one-on-one demo? Great question. So if you go to our website, CareAcademy.com, you'll see on the top right corner, it's the icon that says book a demo. And if you give us your information, you should get a call from one of our team members within 24 hours, if not earlier, and we can have a demo set up for you right away. Is the training done through an app or mobile browser? So we do not have an app, but we use a web app, so a mobile browser to do the training. We did a lot of testing around this, and we actually found that the web browser was a lot easier for caregivers to use, especially caregivers that aren't very tech savvy. And so that's what we currently have, and we do not have an app, no. Can caregivers access all training or only assigned training? That's a really great question. I get that question a lot too. Caregivers can only access training that is assigned to them. So so I'll pull up our dashboard again here. So I can, because I'm getting a lot of questions on the dashboard, and I want to make sure I'm able to respond properly, and I can show you all as well. But so you have, as an administrator, as an owner, you're able to assign the courses for your caregivers. There's no way for a caregiver to assign themselves into a course unless they share that they would like more dementia classes, etc. Then only can you add them. But a lot of our agencies will actually, when they onboard a caregiver, they'll provide them a packet of all classes available to them on the CareAcademy platform. And so if caregivers are interested in taking any more courses, they're easily able to just reach out to their home office, and then you can easily assign the classes that the caregivers are interested in. Please explain how the seats work. So if we buy 50 seats, when a caregiver leaves, does that open up a new spot? Or is it like 50 caregivers can be trained? Okay, again, great question. So it's seats. So you have 50 seats. If Sarah leaves your agency, Ashley joins, then that it's just that one seat, so you won't be charged twice. So you have 50 seats available to you. And what I can show in the dashboard as well is that you have a deactivation feature. So for example, if you want to deactivate Lillian, you would go down here, edit caregiver, oops, and you can deactivate or delete a caregiver here. And what we do is you can also look at all your deactivated caregivers in one spot here, and you can reactivate them if they ever come back to your agency. But we save all the training that's already completed by that caregiver from your agency. We save all that data free of charge. So, we understand that caregivers will, switch agencies depending on the shifts, or will come back to an agency. So we'd like to save that information for you. So when they do come back, you don't have to pay them, a double to take the same classes that they already might have taken at your agency. So you're easily able to reactivate and deactivate caregivers. It's a great question. Can we give out your training to our clients' family members? Yes, you can. That would count as one seat from your dashboard, but you certainly can do that, and we do have agencies that do that as well. Do you have classes for skilled staff like nursing as well? So we're developing, again, we develop classes on a quarterly basis. We certainly have more advanced level courses, like some of our dementia, COPD classes. And so we are releasing a bit more skills classes this year. We currently are waiting on approvals for continuing education for CNAs, so that's in progress as well. But yes, we do have more advanced level classes. What are the credentials of the people who are creating these courses? A great question. So Marjorie Reddy, who's the co-founder and the chief medical officer of the company, she works with a lot of subject matter experts. So she's a geriatrician and again, a professor at Harvard Medical School. So she works with a lot of subject matter experts that are nurses, dietitians, CNAs, caregivers, just to make sure that we have the best content, but also to make sure that the content is relevant for what a caregiver will experience when they and would need to know when they go into a client's home to provide the best care. How do most agencies pay the caregivers for training? That is, so every agency does it differently, but it's basically based on the class length. And I say differently because not all agencies pay caregivers for training, right? But the ones that do will utilize our class length, which is an hour, to pay their caregivers. Any more questions? These are great and questions that I get pretty much in all my demos when I talk to agencies. So feel free to type in more questions. I hope that this has been helpful for you all. Will this work in Ohio? Yes, it definitely works in Ohio. We have a couple of customers. I shouldn't say couple. We have a lot of customers in Ohio, they certainly use our training. I believe I want to say that Ohio is not a compliance. Does not have compliance requirements, but our agencies there develop their own training curriculum from our classes to add to their caregivers' internal requirements on what they need them to complete. Will this work in Texas? Absolutely. Texas is also a non-compliant state. We have many agencies in Texas that do the similar approach where they create their own curriculum based on what requirements they might have from the franchisor in terms of requirements, and then just internally. So I was talking to an agency just last week in Texas that they found that majority of their clients have dementia, so their training curriculum is pretty much all of our dementia classes, and then some of the more soft skill focused classes for their caregivers. So you can definitely do that. In Massachusetts, yes. So the Best of Care, the agency that I referenced earlier, is in Massachusetts, again, a non-compliant state, and we're able to increase their caregiver engagement and completion rates by 482% by switching from an in-person provider to online. What hours is tech support available? It is available 24 hours for caregivers and administrators as well. Okay. I think we received a question about the cost, so I want to just go ahead and put this slide back up. So if there are any questions on pricing, this is the pricing and the promotional pricing that we're offering for HCAOA members, as well as everyone that's on the webinar today. What is the contract length? So we provide a 1-year, 2-year, and 3-year contract. Majority of our agencies do sign up with us for a year. And again, you know, if you sign up for 2 or 3 years, additional discounts are available. So that is something that is available to you all, whether if you want a bit of a longer contract length with us. Okay, so the last call for questions. Just want to remind everybody that this special offer will go away. So sign up now if you want to save $500 on our onboarding and setup fee. So I would love to keep going and answer any questions that you might have. Again, this is the link. Please continue signing up. Can definitely answer more questions in the meantime, so feel free to send more questions in. Oh, and we have, this is great. I'm just opened up my link here showing who all has signed up. So thank you, Home Care Companions in North Dakota. Welcome. Really excited to have you all. Let's see who else has signed up. Respite Care in Illinois. Welcome to CareAcademy family. Really excited to have you all. This is great. I wish I'd opened this earlier. Carly Care from California. Welcome. See, it's going down the list here. Home Helpers, Virginia Beach. Very exciting. Very excited to have you all. I might be saying this incorrectly, but Answered Prayer in Alabama. Hello. Thank you for signing up. Really, really appreciate it. Excited to have you all on. And just so you all know, our customer success team will be reaching out to you all shortly to get the list of caregivers to help you through onboarding and going over your training curriculums. Sound Care Home Services in Washington. Hello, welcome. Thank you for signing up. Comfort Care, Montgomery County, Pennsylvania. Wow, everybody from all the states. I feel like we've captured people from all over. Thank you so much, and thank you for joining the webinar as well. Again, any last questions, feel free to enter your questions in as well. Well, I would like to keep the link in as long as we can to make sure everyone's getting this great offer. Okay, so last call, everybody. Remember, there's a 30-day guarantee to sign up. So if you sign up now, there's definitely an out. But we will definitely work with you all, again, to choose your curriculum, answer any questions. Our compliance team in-house will help you with any requirements that you have or any questions that you might have with your compliance requirements, and get your caregivers on board and ready to go. And if it doesn't work out for you all, if we can help you out in the near future, or if you have any questions on training, we'll be more than happy to help you all, and we can part ways as friends. So thank you all, everybody, for joining. Really appreciate you joining today, and I hope you all have a wonderful Thursday and a great week ahead of you. Thank you.